Wakanuradu, and welcome once again to our daily briefing from the COVID-19 task force. There are several important announcements to be made today, so we're going to waste no time. We'll get right to the Commissioner of Public Safety, Lloyd Phillips.
Thank you, Joe. Good afternoon once again, everybody. Here to just give a brief update on some of the events of today. We have a few speakers lined up for you, so I'll be brief as I can. Again, today was a very busy day for our entire community. Public Safety Division has been very busy today, gathering all the initial information as well as working on the directives that have been issued by the COVID task force, as well as making sure that all the proper information is gathered for this information session today. So today there was formal directives that were set that would set the direction for the community for the next little while. First of all, it was touched on yesterday, but it was formalized today that all organizations in the community are asked to downsize their operations to the essential services only. They were directed to start the planning immediately and implement as soon as they are able to properly address whatever the essential services are and identify what the needs are in the community. They are to start downsizing their operations to ensure, again, essential services are maintained. I had a discussion this afternoon with Mandy Montour from the Case Populaire Kahnawake. They also have a pandemic plan in place. They are operating with modified rules and modified way of to ensure, and again, public safety, to minimize the possibility of having transmission of the COVID virus at that location. You may have heard or may have heard that several Case Populaires in the province are closing as a precautionary measure. Just be reassured, when I spoke to Mandy, she said that Case Populaire in Kahnawake will not be closing. So be rest assured that we'll have access to those facilities moving forward. Some of the directives issued today, again, in the name of public health and public safety. All restaurants were asked to prepare to move directly towards stopping the dining areas in the restaurants, to move towards delivery and pickup services only. As restaurants have been identified as a high area of potential transmission of the disease. So it's one of the areas that no matter how clean a restaurant may be or how much you sanitize, there's still that higher risk associated with this. And you may have seen very similar things happening throughout the province and throughout Canada and North America. So we feel it's an area that definitely had to be addressed immediately. And it's certainly no reflection on the local restaurants. Again, it's all in a matter of public safety. They could have their delivery and pickup services either started or modified to ensure that they continue operations as best as they possibly can. Just to keep in mind, it's important to note that somebody could become contagious with this virus and yet have no symptoms. And what the concerns are is if somebody is in the food industry or in the bar industry and they are frequenting and touching a lot of utensils and plates and cups and stuff of that nature, that even that little bit of touching increases the chances of spreading the virus. And if you had a waitress or a server who unknowingly was infected, the spread of the virus could be devastating. We have 0 cases in the community right now, although the numbers in the province are rising, and we're doing our darndest to ensure that, if every possible method is taken to ensure we have no infections within the community. Mind you, what happens outside Kahnawake is certainly beyond our control, but we could do what we got to do to maximize the safety of our community. And actually, Quebec has been taking also some very strong measures to do so as well. We also gave a directive to ask all grocery and convenience stores to be much more vigilant, to clean the surfaces of our high contact much more frequently, as well as try their best to respect social distancing so that your stores are not full of a lot of people at one time. Again, all to try to minimize the spread of the virus. These are some of the measures that have been formally directed today. And finally, we also had a directive issued that all bars and social clubs are to close and stop serving alcohol, again, because very similar to a restaurant, they're a high area that has the possibility of spreading the COVID virus. And here with me right now, I have actually the chairman of the ABC board to say a few words regarding that. So thank you.
My name is Michael Stalk, Sr. I'm the chairperson for the Alcohol Beverage Control Board in our territory. This morning, I received a directive from the COVID-19 task force after a lot of studies and a lot of information that they received. It's been decided that all bars and restaurants holding permits with the ABC board will cease. That doesn't mean that the ones that don't have permits can stay open. The directive was for all restaurants and bars, and Lloyd had already spoke to some of the reasons for that. The ABC board is always worried about the health and safety of our community, and we want to make sure that if this virus does come into the community, which we want to try to stop it, or to at least be able to have the least amount of people get this if it ever happens. So as of this afternoon, all the bars and restaurants that have alcohol permits were issued a letter from the ABC board directing them to close and not sell alcohol and or have a restaurant full of people, and Lloyd and some of the other people following me will explain more about that. But I just want to read part of this letter that was a directive to all the bars and the restaurants who have alcohol permits. It's dated today, the 17th. Dear ABC permit holders, regarding the global pandemic COVID-19 virus. Due to the global pandemic COVID-19 virus, the ABC board has been directed by the Kahnawake COVID-19 task force to notify all restaurants and bar permit holders to close effective immediately until further notice. This measure is put in place for the health and safety of our community. One other thing that I want to say, I know that the bars and the restaurants have received a letter. For the ones that have not received it yet, it will be in the mail. There's additional information in regards to your staffing and possible remuneration later down the road. But we'll have to discuss that later as we get more information as it comes in from the province. So anyway, I'd like to thank you very much. If you have any questions at all, call the ABC board at 450-635-2002, or you can try to contact me via social media. The last thing that I want to say is the monitoring and enforcement of these directives is the sole person are going to be the Peacekeepers. So if there's any other questions or concerns, you can also try to contact them. Thank you.
All right, Mike. And speaking of the Peacekeepers, we'd like to call upon the Chief Peacekeeper, Dwayne Zachary, who will give you an update.
Good evening, everyone. The update I'd like to give is that I want everyone in the community to know and to realize that for the Kahnawake Peacekeepers, safety is our primary concern. So if you see Peacekeepers out on the road and there's a little bit of a different look to them, they may have gloves on or masks or anything like that, don't be alarmed. It's just that we're trying to practice some safe practices, right? Because we're deemed an essential service and we need to be able to provide services continuously to the community. So they'll be wearing or have personal protection equipment. They'll be practicing social distancing, so if there is a call that they have to respond to for you, don't be alarmed or don't think there's anything strange. It's just that they're going to be practicing some different safety measures at this point. Also, just to go back to what some of the gentlemen before me had mentioned, if you do receive a letter and you're asked to comply with a particular area, please do so. It's for the safety of our community. One area that I wanted to update the entire community about is be aware. So every time something new happens in the community, like this emergency, there's also some criminality associated with it. One of the areas is that now there is COVID-19 fraud. So what that means is people are contacting individuals either by phone or by email and offering tests. Only tests can be done by a hospital, right? So please don't use your credit cards. Don't give credit cards out to anybody. Don't think you're getting ahead of the line, because that's not happening. They're also selling you low quality goods that are coming from other countries. They're of no use, and they're not to test for COVID-19. So please don't purchase anything. If you have any questions, contact the Peacekeepers and we'll give you more information. 450-632-6505. Also, remember, anything online, you should always question. If you have any other questions about medical procedures or what have you, you can contact your health provider. Nobody's going to contact you. That's not what the hospitals or doctors are doing at this point. So please be aware that there is fraud that's going on, and please everyone be safe and comply with any of the orders that are given. Thank you.
Right now, Dwayne, and once again, as yesterday, we'd like to welcome the Executive Director of the Kateri Memorial Hospital Center, Lisa Westaway, who will give you an update from the health point of view. Lisa?
Thanks. Good afternoon. So I wanted to give you an update on the total amount of Quebec cases. So we're up to 63 as of today. There are 11 cases identified in the Montérégie area. There are no identified cases in Kahnawake. So up till today, we don't have any diagnosed cases of COVID-19. I wanted to also talk a little bit about the testing clinics. So the government is putting in place up to 31 clinics by the end of the week. So they're adding 9 clinics, and the amount of testing that they'll be able to do per day is going to go up to 6,000 per day. Also, there have been some difficulties reaching the 1-877-644-4545 line. This is the phone number that we're instructing you to call should you think that you may have COVID-19, if you've traveled and you have a cough or shortness of breath or a fever. They're adding 55 nurses to those phone lines, and from experience today, we were able to get through and have answers within 45 minutes. So that is also improving as we go along. Just some regular housekeeping items regarding KMHC and community issues in general. For as of now, laundry for residents, inpatient, are being done on site. Families will be contacted if you haven't received a phone call yet. Also for ambulance, important to mention that as of late last week, for ambulance, children will be able to be accompanied by one adult, but there will be no other transports that will have accompaniment. Daycare, just to talk a little bit about the wonderful show of solidarity in the community. For workers, for essential services, employees that require daycare, Step by Step has opened their doors for the 0 to 5. Please speak with your organization should you require daycare for 0 to 5-year-olds, for essential services and public service workers. The youth center and the Ed Center are looking at putting in place services for over 5-year-olds. So thank you to the community for a wonderful show of solidarity that allows us to continue to provide service. We've had some telephone calls from concerned family members. Yesterday I said, please trust us with your elders, with your family members. We know that it's been really difficult and anxiety-provoking for all of you that you can't visit inpatient. So I wanted to talk a little bit about the measures that were put in place to try to reduce that feeling of isolation for residents. So the first thing is that it's business as usual. We're really trying to decrease anxiety, continue with our activities, although they're very much modified, sometimes, you know, running in different areas and in much smaller groups. But we're really trying to keep things going as they were before. Staff are spending extra time with your loved ones. They're sitting with them at meal times. So for residents who are used to having a family member join them during meal times, we're sitting with them and we're keeping them company. We also have a social worker and an activity worker that is meeting with each individual resident every 2 days, and we're really evaluating their well-being. So if there are issues, we're keeping in contact with families, and just to add that we'll also be contacting families every 2 days so that you'll have information about how your family member is doing. We're also encouraging, and these are measures that are being implemented as we speak, so you may not have received a phone call yet, but you will. It's going to be split over days, but it will be approximately every 2 days. We're also encouraging phone calls. So if you would like to call a family member, then please call their line directly. If you can't reach them or they can't answer the phone, then please call the nursing station. If there's no answer, leave a message. Very important that we're encouraging those phone calls. And lastly, I'd just really like to thank some very generous community members who are going to be donating iPads, so we'll be working that out in the next few days so that we can encourage FaceTime between residents and family members. So the details I'll bring to you at further updates, but I really wanted to thank the community again for working together in ensuring that people are well taken care of. I guess the last message, one other housekeeping item for KMHC. For inpatient, people are used to coming to the hospital to make payments for inpatient. We'll no longer be accepting cash payments, and we ask that all payments be made by check or money order by mail to KMHC. A last message that I'd like to make is you know, we mentioned yesterday about the urgency and the importance of following the guidelines and the measures that we're implementing. We've heard various comments. We're being, you know, overly zealous, and we're way too overboard. And on the other side, we have people who are really not taking us seriously. And since youth and children are home, we see that there are many gatherings happening at the rinks or at people's homes, big groups of children or youth that are meeting together or walking in the streets. So the message that we'd like to make is that this is, the first message I'd like to make is, you know, I'm very willing to come on and do this update after all of this is over, and for all of you to tell me that we overreacted, I will be very happy if that's the case. For now, what we're asking for, whether you agree with the measures we're implementing or not, that you respect them, that we have the debate later on, that you respect them now because people's lives are at stake. Our ability to provide appropriate medical care to our population is at stake if we're not following these measures. And I direct very specifically to our youth. I ask that they stay home, that you take the opportunity to reconnect with your families, to play board games, to read, to paint a room, to be in your home environment and take care of each other without going out and being in groups. You should no longer be doing that. So that's the last message that I wanted to give. Lloyd, did you have something to add? Thank you. We really appreciate it. Sorry.
Okay, thank you very much, Lisa. Yeah, and just to put a personal touch on what's being said regarding the Kateri Memorial Hospital Center and the inpatient. And I said this on the radio the other day, I have both my parents in there. So these measures are not extreme. These measures are taken to protect them. And as we've seen in other parts of North America, in BC and in Washington State, where the COVID virus managed to get into a similar facility as inpatient at Kateri Hospital, and it was devastating. 15 to 25 people have perished, have died, and that's the last thing we want to see happen here in our community. So these measures are taken to protect our elders, and that's from medical advice, but also on a personal level, that's advice that I fully 100% respect. One other area I want to touch on is to add to a directive was also issued to any gyms in the community that they are also to cease operations. Gyms as well, obviously it's a very high contact area that is known to spread viruses very easily, so they were also directed to close. I also want to mention that a lot of the business people who are impacted by these decisions have taken measures even prior to these directives being issued and have voluntarily took precautionary measures. Some have voluntarily closed, which is certainly appreciated. And actually, today and the past couple of days, several of these businesses have reached out to community representatives, myself included, hospital and such, and offered assistance. And basically saying, whatever you need as a community, if you need us to do something, we're there for you. So that, again, I truly, truly appreciate that. At this point in time, we have most of what we need, but if this progresses and gets to be more of a crisis, we may be reaching out to you for whatever assistance that we may require. As the community organizations are downsizing to essential services only, we may have be able to redeploy some of the staff to other areas to assist. But again, we're looking at this from a whole community perspective, and again, we appreciate everybody's input and everybody's willingness to chip in. And again, like I said yesterday, the true community spirit is there. Certainly, you're going to have some people who are going to disagree and think these measures, as Lisa mentioned, are extreme. But we, as a community, are more vulnerable than anywhere else, simply because the fact that we're all in the community, we all live here, we're closer families, we're closer to our elders, we're closer to our children, and all the families live here in the Kahnawake. Whereas in Chattagee and other places around us, their families are scattered throughout the province or throughout Montreal area, or maybe sometimes even throughout the world. We're all together. So if the virus starts impacting our elders here and it really gets hold into our community, we are much more vulnerable. That's why we have to take very strong measures now so that it does not happen in our community. There's no guarantees anywhere, but this is what we need to do now to ensure that we're protecting our elders, the most vulnerable people in our community, and that's the bottom line. We're doing this to save lives. Thank you very much.
All right, thank you, Lloyd, and thank you, Lisa, Mike Stalk Sr., and our Chief Peacekeeper, Dwayne Zachary, as well. Once again, if you're watching this now, we will be having daily briefings around this time. We'd like to have them near 4 o'clock. Sometimes circumstances may delay it somewhat, but that is our intent. And you can always check it out, Kahnawake 911. It's on Facebook. And tell people about it. If they make sure you forward this message so that everybody has the same information in Kahnawake. We're all playing from the same playbook, so to speak. And with that, we'd like to thank you for watching. And once again, we'll be here tomorrow, same time. And everyone, stay safe.